I'm a board-certified dermatologist, and today we're answering Google's top questions about hair loss. I'm Dr. Dina Strawn, and I help people with hair loss get to the root of their problem.
How much hair loss is normal?
It's normal to lose hair every day. We lose about 50 to 100 hairs a day. What becomes of concern is when you suddenly notice an increase in the amount of hair you lose every day, when there seems to be shedding and it happens suddenly.
What causes hair loss?
Many things can cause hair loss. Hair loss can be caused by your diet. It can be caused by having a fever, surgery, giving birth. There are also types of hair loss that are diseases of themselves, such as lupus can cause hair loss. People have things called CCCA. So there are many types of hair loss, just like there are many types of infections.
Is hair loss reversible?
There are different types of hair loss. There are two categories. One is called scarring and one is called non-scarring. Generally, we think of non-scarring alopecia as being reversible because the hair follicles are intact, they haven't been damaged, and they should be able to grow hair back. Whereas we think of scarring alopecia in which the hair follicles have been damaged and they're sometimes dead. So it depends on what type of hair loss you have and then how severe it is. Because even with scarring alopecia, not all of the hair follicles have been destroyed, so there is a potential for hair loss to come back. That's why it's important to get a diagnosis.
Can hairstyles cause hair loss?
Certain hairstyles can trigger hair loss or cause hair loss. Common ones we see are called traction alopecia. That would be tight ponytails, tight buns, tight braids, anything that puts tension on the hair like a weave, heavy dreadlocks that put a lot of tension on the scalp can all cause hair loss. So you have to be careful not to put a lot of tension, pulling on the scalp. Otherwise, you can trigger different types of hair loss.
Do vitamins or supplements help?
People commonly want to reach for a vitamin or a supplement when they have hair loss. Whether or not those are helpful really depends on whether or not you have a deficiency in that vitamin or supplement. If your cause of hair loss is not related to a deficiency, taking excess biotin, is not necessarily going to be helpful. Fun fact, zinc is something, if you're deficient, can also cause hair loss. But the blood test we use for zinc deficiency is looking at the zinc levels in your vital organs. So even when you have normal zinc levels, if they're on the lower end, zinc can be causing your hair loss. So you have to make sure that you understand how to read that test.
Why is my hair falling out after pregnancy, COVID, or stress?
After problems like COVID, stress, or even after childbirth, a lot of people experience hair loss, and that type of hair loss is called telogen effluvium. And this is when your hair gets out of its cycles of shedding. Like I said earlier, hair always falls out, so it goes through a cycle where it's growing, it's resting, and then it's falling out. With telogen effluvium, all of your hairs get on the same schedule. Usually your hairs all have their own schedule, and so they're falling out individually at a time. With telogen effluvium, all the hairs end up falling out at the same time. That's why you get the hair shedding. But that tends to resolve on its own, so long as whatever it is that is causing it has been resolved.
What's the best treatment for hair loss?
The best treatment for hair loss depends on why you are having hair loss. So if, for example, if you have zinc deficiency, then you should take zinc for your hair loss. If you have telogen effluvium, you want to identify what the cause of that is and see if it's just going to pass on its own or if you need to make an intervention. If you have scarring hair loss, such as CCCA, which is caused by inflammation, you have to address the inflammation in order to treat that hair loss. So there are many things that we use for all different types of hair loss. We might use minoxidil, we might use Almated, but those are things that we use as tools that they aren't necessarily going to treat all kinds of hair loss if you haven't addressed the underlying cause.
What are the signs of permanent hair loss?
The signs of permanent hair loss, usually from scarring alopecia, is that you'll see a reduced number of hair follicles and the scalp can look shiny and smooth. But you can be surprised that even in patients with very shiny scalps from scarring alopecia, that with some interventions, you can revive some damaged hair follicles that aren't dead yet.
Will my hair grow back?
Whether or not your hair grows back when you have hair loss or alopecia, depends on a number of things. Different types of hair loss, such as scarring hair loss, can cause permanent damage to certain hair follicles. And so in those particular hair follicles, no hair will grow back. But that's not to say that there aren't other hair follicles that appear to be completely damaged, but actually are viable with some help, with some treatment. So really, we determine whether or not your hair will grow back by trying to make it grow back with treatment.
Does wearing hats cause hair loss?
Hats can cause hair loss if they cause damage to the scalp, if they cause trauma. So if your hat is too tight and it's constantly rubbing on your scalp or pulling on your hair, it can contribute to hair loss. Think of it as like it causes traction alopecia.
Can stress truly cause hair loss?
People often ask if stress can cause hair loss, and I think that we don't really know for sure. With my practice in dermatology, I've only had one patient in many decades of practice that I could really say their hair loss had no other explanation than stress. When we think of stress causing hair loss, we think of life-threatening stress, not, you don't like your job or you're having an interpersonal conflict with someone. So someone who survived a plane crash, that could be the kind of stress that has been shown without finding any other cause can cause hair loss. But regular stress doesn't appear to be the main cause of hair loss, but people are studying stress and its effects on the body, so there's probably more information that we're going to get in the future. If you've been Googling and haven't found answers, don't guess. Hair loss can be tricky to figure out what's causing it. You should go see a board-certified dermatologist who's an expert in hair loss to help you determine what kind of hair loss is affecting you so that you can get the right answers and the right treatment. If you are ready to find out what's causing your hair loss, schedule a consultation using the link provided. Hit subscribe and you'll get clarity, not confusion.